Hi, everyone. Welcome back to This is a Woman podcast. The other day, a couple weeks ago, Taylor Swift endorsed Kamala Harris. And so I put out a tweet where I just said, Taylor Swift said to go do your research. And so I did. And so I'm going to be voting for who can actually, and I didn't even say who I was voting for. I just said I will be voting for the party that can define what a woman is going to defend and protect women's sports and spaces, and is going to stand against the erasure of women. To which, a million views later and lots of comments, a lot of people started commenting along the lines of, I hope you never have a miscarriage or an ectopic pregnancy, because then you're not going to get treatment for it. And then some people even said, I hope you do have one, so you can't get treatment for it, which is absolutely absurd because one, ectopic pregnancies and miscarriages are not the same thing as abortion. Two, treatments to ectopic pregnancies and miscarriages are not going away in any state. Three, absolutely disgusting that someone would wish that upon someone. So we're going to dive into this episode and talk all about the differences with a doctor. Women are currently being erased in culture, and I want to amplify their voices and share their stories. So, like I kind of said, we're going to dive into this episode with a doctor. We are going to talk all about how abortions are different than ectopic pregnancies and miscarriages. And I can sit here and say it all day long, but I know so many are going to say, well, you're just saying that, you just believe that. So no, we are going to have a doctor come on and explain how they are different, and thus we won't lose access to that treatment. So the guest today is Dr. Maralee Bowers, and she is a board-certified family physician practicing in Northern California. She works with local pregnancy resource clinics and the abortion pill reversal hotline. She graduated from UC Davis with a BS in Neurobiology, Physiology and Behavior with honors, and received her MD from Northwestern University Feinberg School of Medicine in Chicago, Illinois. She continued her medical training in the family medicine residency program at Hinsdale Hospital in Illinois, and then moved back to her hometown to practice. She's one of the few remaining family physicians doing house visits for homebound patients, as well as a general primary care in office. She's also a mom of 5 kids, ages 7 through 21, and the wife of a Catholic Deacon. She believes that faith and science are the basis of truth, and one cannot exist without the other. So with that, let's dive into it. Well, hello, Dr. Bowers, and welcome to This is a Woman podcast. We are so excited to have you on today.
Hi, Sophia. Thank you for asking me to be on.
Yes, and so there has been just, with it being election season, with Roe v. Wade being overturned, with so many things, the focus of life and abortion has been very prominent on social media, in the news. Shoot, you're walking down the streets and you're seeing Planned Parenthood signs and pregnancy center signs. It is everywhere. And
Right.
I have come to the realization that there is a lot of people that believe abortion, miscarriage, ectopic pregnancies are all the same things. And so I just want to, are abortions, ectopic pregnancies, and miscarriages, are they the same, Dr. Bowers?
They are not the same. I was actually talking to a friend yesterday who is pro-choice, and she said there's a major difference. Abortion is a choice. Miscarriage, ectopics are a medical condition, which is very, very true. So an abortion is a choice to end the life of a baby growing in the womb, whereas an ectopic and miscarriage are problems that occur in the pregnancy. So an ectopic means something being in the wrong place. So it's where the sperm and the egg have come together, so there is a baby, but the baby does not implant in the uterus where it can grow and develop. Instead, it gets stuck in the fallopian tube. That's the most common place for an ectopic pregnancy. Sometimes it can travel too far down the uterus and get stuck in the cervix. Sometimes it can actually come out of the fallopian tube and be around the ovary or even in the abdominal cavity. Most all ectopics occur in the fallopian tube. But without being in the uterus, the baby can never implant. It can never truly implant and form a placenta. It will grow enough that it can cause a problem, like cause the fallopian tube to rupture, and that can cause the mom to hemorrhage and die. So we know that unless the baby is implanted in the uterus, it will not survive. It will only grow to a certain point. It cannot survive without being implanted in the uterus, um, and it puts the mom's life at risk. So it is a medical emergency, and in all states, there are laws that protect a woman to be able to get treatment for that. The gold standard treatment for an ectopic pregnancy is surgical removal, where they do a minor surgery, like a laparoscopic surgery, and remove the portion of the fallopian tube that the baby is in. Obviously, the baby will die, but it saves the mom's life. If it's early enough in a pregnancy, they can use an abortion type drug called methotrexate that will essentially kill the baby. Um, and then the woman can pass, because if it's small enough in the fallopian tube, they can do it that way, and so then the woman will just pass it like a period. Um, if we're talking ethically, morally, it's interesting. The Catholic Church actually teaches that the best way to treat an ectopic pregnancy is that surgical removal, like we talked about first, because it is not killing the baby. Obviously, the baby will die, but it's not intentionally killing the baby. So I think that's just kind of interesting. But even the methotrexate is fine if it's early enough in the pregnancy. A miscarriage is when something happens, that there's something wrong with the baby and it doesn't develop and it dies naturally in the womb. Um, Most miscarriages happen within just the first 6 to 8 weeks of pregnancy when the baby is still very, very small, about the time that her period was due. So a lot of miscarriages happen without mom even realizing she had been pregnant. Um, Occasionally, if the baby dies naturally in the womb later in the pregnancy, like I have little baby models here. So this is a baby at 12 weeks gestation. So this is in the first trimester at 3 months, 12 weeks. If you're to have a miscarriage at that stage, it's a little harder to pass. And I mean, it feels like labor, which is what the abortion pill does too. It feels like labor. But anyhow, occasionally with a miscarriage, um, not all of the contents of the pregnancy shed normally. There can be retained parts of the placenta or the uterine lining, and that can cause pain and infection. So they do often go in and do a D&C to clean the uterus out, to complete the miscarriage. But at that point, the baby has already died, of natural causes. Usually it's chromosomal defects. Um, so, so that's the main difference. So ectopic and miscarriage, and then abortion is the intentional killing of a baby. So the baby is alive, growing fine in the womb, and a medical practitioner gives a woman either pills or, if the woman is further along, a surgical procedure that kills the baby.
And so I'm so glad you pointed that out where an abortion is intentional. It is a choice to end the life of a baby, where that is not the case with miscarriage and ectopic treatments. And so I do want to dive a little bit more into the D&C side of it. And that's just because um, I've gotten so many tweets. I mean, people saying, I hope you never have an ectopic pregnancy or miscarry because you will have no options, which we know at that point they are wishing that upon me, because I'm pro-life. And so, I mean, that's the main reason we're having this episode, because people really think that women, we're going to be left without options. We find ourselves in these situations. Um, so one person said, women who miscarry will not be able to get the necessary care they need. To which I responded, there's no state where a woman cannot get care for a miscarriage. That's a blatant lie. Their
Right.
response was, a D&C is an abortion. A D&C is what's used often to follow an incomplete miscarriage. And so again, they are not, in their minds, they're not able to separate the two. So if you were responding to that
Right.
person and trying to just, as clear and concise as possible, separate how, even though it's the same procedure, could you maybe explain? And I know you already talked about this, but I just really want to dive into the difference.
Right. Right. DNC means dilation and curettage. Dilation of the cervix, the little opening to the uterus, and curettage is like scraping of the uterine lining. It is true that a DNC can be used both with a miscarriage and an abortion. The difference is, in a miscarriage, the baby has already died. The baby has already died of natural causes, where in an abortion, they're dilating the cervix, going in and scraping out a living baby.
So, I mean, folks, it's as simple as that. The baby is already passed away versus natural causes versus an abortion is an intentional killing. Um, so women aren't going to not be able to get the treatment they need. That is a blatant lie. But Dr. Bowers, I want to dive into, you're a doctor, you're sitting here, you're pro-life, you're telling us these differences. We don't often see that from the medical field. So, and a lot of people will say, I mean, I know people that are nurses or doctors involved in the medical field, and they say they're pro-choice because of all their research and all of that. So, for yourself, how do you come at it from the angle of you're a doctor, you've done the research, you know these things, and you recognize that it's a life and it's a human being?
Right. I don't think it's deniable. It's interesting. I mean, we know that when the sperm and egg come together, a genetically unique person is formed. The minute the sperm and egg come together, um, the cells start to divide immediately. Within just a few hours, the cells have divided into several different cells. If you take the DNA out of one of those cells and look at it, it is a unique individual. It's not the same as the mom. It's not the same as the dad. It has half of the dad's genes, half of the mom's genes, and probably already a couple mutations by then. It's a unique individual. So, I feel like it's just obvious. I don't know how other people don't understand this. Um, I suppose my own personal journey, um, when I was in high school and early in college, I didn't think that much about abortion. I suppose I thought, well, that probably would never happen to me, but I'm not going to get involved in somebody else's decision. And then I had a close friend when I was pre-med. She was also pre-med. We were taking all the difficult classes together. And she was basically using abortion as birth control. During our time in college, she had at least 3 abortions that I remember. And I, would go help her after the abortion. I took her our homework assignments and helped her catch up in the classes that we were taking together. And I don't know what happened to her, but I know she did not go to medical school. So her reasoning was she couldn't have a baby right now. She wants to go to medical school and she has this career ahead of her, so it's not a good time. And I know that she never went. So obviously it didn't help her with her life goal. And then the other big step for me was right when I started medical school, my husband and I became Catholic. And in learning all the teachings of the church, I remember the teaching on birth control and abortion, but I just didn't really think it applied to me. I was in medical school, so we were contracepting. I was using birth control pills. Our plan was to wait until after residency to start a family. and it just didn't, that rule of the church didn't apply to me. And then one night during my third year of medical school, I woke up like a, clash on the head. What are you doing? You should not be contracepting. And I told my husband, I think that we should stop. And he was okay with it. So I went off the pill. And back then, doing symptothermal method and being on call all night in the hospital, your basal body temperatures are not very reliable. So lo and behold, my now 21-year-old son, Thomas, came into the picture. So I was in my fourth year of medical school and pregnant. And that completely changed the course of my life and my husband's life. Definitely an unexpected pregnancy, definitely not what I had planned on, and it changed everything. I was planning on specializing and instead interviewing for residency 7 months pregnant. Really, the only welcoming group was the family medicine residency programs. And so I did family medicine. My husband is a lawyer. He was preparing to work at a big downtown law firm in the city of Chicago. And knowing that I was going to be in residency with a baby, he instead took a small job in a suburb. And those decisions that seemed like crisis decisions ended up being the biggest blessings in our lives. So it completely oriented our life. I've now been doing family medicine for 20 years and I love it. I can't imagine doing something different. I would not have been happy specializing. My husband still works for the small law firm that he joined. He would not have been happy in the big corporate law firm in Chicago. Um, we moved back to our hometown, and we now have 5 kids. But Thomas knows that he's kind of the miracle that pointed us in the right direction. And so I realize it's not quite the same as somebody in an unmarried crisis pregnancy, or, not everybody's situation is the same. But what I learned from that is what we think we want and need is not always the case. And sometimes unexpected things come just at the exact right time, and we should just roll with it. Um, yeah. And then go ahead.
No, I was just gonna say I love that, and it's so powerful because it is like that's I think the lie so many women are fed, that if you find yourself in an unexpected pregnancy, your life is over. Your everything
Yeah.
you wanted to do is over. And in reality, both yourself and your husband, you were still able to do the things you want to do. They changed paths, and maybe like you said, you didn't get a specialize. He wasn't at the big law firm, but I mean, looking back at it, the fact that you can see like those were blessings in disguise, and that you could have
Right.
not been happy in that. And so
Right.
I think women are so often told that you're not going to be able to like live out your dream or do what you want, and not told that it's possible to still live your dream and still raise a child and figure out how that works
Right.
together.
Right. Right. Um, and then the other thing that has helped continue to support me in being a pro-life physician is just dealing with a lot of patients. I mean, I've seen so many people, so many women in my career that have had unexpected pregnancies, and or that have had abortions. And my general feeling is that the women who've had abortions are just generally not well. Um, they're not emotionally well. They're not physically well. They suffer from chronic pelvic pain. They suffer from fibromyalgia, abdominal issues, migraine headaches. It's amazing the way that interrupting something natural will affect the body. So psychologically, physically, they are not well. Whereas, women that I've dealt with who had an unexpected pregnancy and kept it, or put a baby up for adoption, maybe have a wound in their life, a pain, a sadness, but there's um, a joyful peace about them.
Mhm.
So again, I realize that's a huge generalization, but just seeing the outcome of either choice, um, universally, it seems like people who've had abortions just have a lot of painful things in their life. Um, I've also seen a lot of women harmed by birth control,
Mhm.
um, blood clots and strokes and breast cancer that probably were the effect of birth control. Um, so yeah, it's sort of, I mean, I realize I'm probably biased, but it keeps I keep seeing evidence that birth control and abortion are bad for women.
Absolutely. And that is myself being Christian, I've always been like, yeah, I'm pro life because that's what we're supposed to be, right? And then kind of had that moment when I was 17 years old where I was like, wait, what is abortion? And recognizing the reality of it and kind of having that like come to Jesus moment about it of not just like, oh, I'm pro life because I'm supposed to be, but being, I'm pro life because I'm against seeing what's happening. I'm against
Right.
these innocent unborn babies' lives dying. But I think even from 18 till now, like over the past 6, 7 years, as I've just been like studying about what abortion does, and like you said, the harm it does to women, I think, and again, like I'm against abortion because I'm against the innocent lives ending. But also, I think we could fully argue why abortion is wrong because it's anti women. And so
Yeah.
yeah, there is a lie being spewed to women across the nation, across the world, that abortion is a woman's right, that it's healthcare. And it breaks my heart because, as you said, I can sit here and say, you can solely be against abortion, not even because of the baby, but because of what
Right.
it does to a woman.
Right.
And
Right.
so, what kind of, when you see, oh, abortion, it's a woman's health care, it's a woman's right, what goes through your mind when you hear people say that and you see that happening?
Right. Um, just sadness that they don't understand, that there is a lie. The minute a woman gets pregnant, her life is dramatically changed. There's no doubt about that. Um, you cannot go back. You can't erase. If there's a pregnancy, you can't just have an abortion and think you're going to go back to where you were before you were pregnant. Your life is permanently changed with that new life growing in you. Um, so which road you choose at that moment can definitely determine the future of your life. But you can't go back. And so you need to make a choice that you're going to be able to live with, and that is best for your body. And if you know the truth that that is a new life, the minute the egg and the sperm come together, probably when you're still having intercourse, the egg and the sperm are coming together. Once that new life is there, you cannot erase, you cannot go back, you can't go back in time. So the new life is there. So we need to decide now, what to do. And no doubt that can be a crisis moment, but the crisis really occurred with the pregnancy, not with at this moment. So at this moment now, you need to decide what's going to be the healthiest, um, and also taking into account that that is a unique human being, that if you choose the route of ending the pregnancy with abortion, you are killing a human being. And that's going to be on your conscience for the rest of your life. Um, there is healing, there's very good counseling that you can go through after an abortion. And, as Christian people, we know that God forgives and God loves and is all merciful and can heal us from that. But it still is a much deeper wound than, um, giving a baby up for adoption, or changing your plans and raising a child.
Absolutely. And I think so much of this on the woman's health angle of it really comes down to a lack of informed consent. I mean, I think not just for abortions. I mean, most girls and women that are having abortions, they don't know what an abortion looks like or what it really is, and they don't
Right,
want to know because I do think every woman deep down
right,
knows, and so they don't want to know,
right,
don't want to ask the questions. And most abortion facilities aren't going to tell them the truth. But same
Right.
thing for birth control. I mean,
Right.
women are on birth control like it's popping an Advil for a headache. I mean, they are taking it
Right.
like it's nobody's business. Like,
Right.
and I think a
Right.
lot of that, again, at the end of the day, goes down to there is informed consent on the effects of birth control on your body and how it really can change. Like, I feel like it really could change who you are as a person
Right.
because it's stopping your body from doing a natural process. And
Right.
so
Right.
I just feel like I don't know why that. I feel like for abortion, I understand why that informed consent is there because they don't want women to actually know what's going on with abortion. Because, I mean, think about Planned Parenthood. If women start seeing
Yeah.
videos of what an abortion is, their sales are going to go down. They're going to lose out on money.
Right.
They don't want the truth. But birth control, I yourself being a doctor, is it talked about much in the medical field about how it really affects a woman? Do you think women get or girls get informed consent before they start getting on birth control?
No, I mean, it's available over the counter now. So obviously they're not getting informed consent. And I think it's a problem with our culture thinking just the most immediate um, conveniences, you know? Um, but definitely it's affecting things that probably we're not even aware of. There's the medical risks like blood clots, strokes, um, breast cancer, but also it's probably doing things chemically to us. There's a theory that birth control pills can change our pheromones because it's not the natural level of estrogen and progesterone. And so we might actually be attracting the wrong mates. I just think that's kind of interesting. Like birth control might actually be affecting, the gene pool because we're not attracted to the right people that we're supposed to be with. Um, so yes, the other thing that's troubling is being over the counter birth control, and we haven't talked about the abortion pill,
Mm-hmm.
but it's so easy to get now. Um, Going back to ectopic pregnancies, it's possible that birth control pills and the abortion pill um, could hide an ectopic pregnancy that then causes more harm to the mom. So if a woman takes a pregnancy test, it's positive, it could be either in the uterus or an ectopic. And the only way to know for sure is with an ultrasound. It used to be that to get an abortion, you had to have an ultrasound. That's not the case anymore. You can get abortion pills, through the mail, and nobody's done an ultrasound. So the abortion pill will not affect an ectopic pregnancy. So if there's a baby growing in the fallopian tube or elsewhere, the abortion pill will not kill the baby. Um, there's other medication that can, but the RU486, the abortion pill that's so easy to get now, will not disrupt an ectopic pregnancy. And then after taking it, she starts having cramping and pain, and she might just think that that's the effect of the abortion pill, where in actuality it's the ectopic that's about to rupture.
Mm.
And so taking the abortion pill, like self-treating your pregnancy, can be very dangerous because it can hide an ectopic and cause, death. There have been deaths from women taking the abortion pill who have an ectopic pregnancy, and they're not getting medical treatment for it.
And
So,
so, as you mentioned, that abortion pill, it really is extremely easy to get. Like you said, you can get it in the
yes.
mail.
Yeah.
I think it's very interesting. After the overturning of Roe, everyone's like, are we going to see abortion numbers decrease now? But then, because of the abortion pill, we're seeing numbers there increase that now most abortions nowadays are through the abortion pill. I think a
Right.
lot of that has to do with the fact that um, I just think as a woman, if I was like not pro life and didn't know what I was doing and found myself in an unplanned pregnancy and was like, well, abortion is the only option. But if I knew I had to go somewhere and it was going to be like the surgical abortion and all this stuff was going to go on, I think I'd be like, ooh, I'm not sure. But again,
Yeah.
this abortion pill, it's like taking Advil, and these girls
Right.
don't recognize what's happening. So could you maybe walk through when, and because I know there's two pills to take and all that. So for those that aren't familiar, and a lot of people, they think abortion pill, when we say abortion pill, they think we're talking about Plan B, which we're not talking about that. Those are two
Right.
separate things. So could you maybe walk through
Right.
how the abortion pill works?
Right. So the abortion pill is actually two pills. It's mifepristone is the first pill that you take, and it is a progesterone blocker. Progesterone is like the glue that helps the baby to implant in the uterus. It attaches the baby into the uterus. About the ninth to 12th week of pregnancy, the placenta is formed, which then is what holds the baby on. But up until that point, it's progesterone that's kind of holding the baby on. And so mifepristone is a progesterone blocker, which basically then will cause the baby to detach. Interestingly, it doesn't kill the baby. It just causes the baby to detach from the uterine wall. So then a couple days later, you take misoprostol, which is a medicine that will induce labor. So you've detached the baby from the uterine wall, and now you induce labor so that the baby will pass. Um, it won't really work after about the 12th week of pregnancy because the placenta has formed. And so the pregnancy is not as dependent on progesterone. So that's a problem. You know, women taking the abortion pill without any medical intervention, they might be further along than the 12th week. And, you know, who knows what it will cause further along. It's probably not going to cause the baby to detach, but then you take the second pill that induces labor, it might cause preterm birth or just problems, you know. Um, Another thing, I'll put a plug in here for abortion pill reversal. So there is a hotline, a national hotline for abortion pill reversal. I'm on the hotline. If a woman takes the first pill, the mifepristone, which causes the baby to detach, and then regrets her decision, if she doesn't take the second one yet, we can flood her system with progesterone. We can give her really high doses of progesterone, which will then allow the baby to reattach or to not detach if it hasn't happened. So that's a really beautiful thing because the first abortion pill, it doesn't cause birth defects, it just causes the baby to detach. And then we can reverse it with progesterone to keep the baby well attached. Um, so you know, anyone, we all make decisions that we regret. If you've taken the first pill and decide that that wasn't the right thing to do, then know that you can try to reverse it. It's about 60% effective to reverse it. Um,
Absolutely. And yes, if you are listening to this episode, like that is, there's so many things I want you to take away, but I want you to remember that if you find yourself or a friend is calling you up and is like, hey, I took an abortion pill and I'm regretting it and I don't know what to do. And the Planned Parenthood I went to is telling me it's too late. I need to pop the second pill and that's it. There are other options to do. Call the abortion reversal pill hotline. Um, and like Dr. Bauer said, it's that 60%. So we can't say absolutely it's going to save the baby, but we can say there's that chance. And so make
right.
that phone call and get on that pill to reverse it. And it's so funny in California, we're facing quite a few lawsuits. Pregnancy centers are facing lawsuits in regards to this abortion reversal pill. And what's so interesting is the line that they keep using when they say you can't be using abortion reversal pill, all that. The line our attorney general is using, the news outlets are using. They said, well, there's no well done scientific study around the abortion reversal pill to which kind of what myself and California Family Council, the organization I work for, what we've been saying in response to that. How would you actually morally do that study? Because then you would have to take a bunch of pregnant women and say, you guys all need to take an abortion pill and put your own baby in harm's way. So now you have to find women that are willing to put their baby in harm's way to then take the
Right.
abortion reversal pill and hope that the progesterone works. I mean, I'm no doctor, but I don't think
Right.
that's
Right.
how medical, like all these trials work. I don't think you
Yeah.
can actually morally do that.
Right. Yeah. All medical studies have to go through an ethics committee to make sure that it's ethically permissible, that we're not harming animals in experiments. So this would be harming a baby. So you're right. That exact study is not going to be done, but there is an ongoing study. So there is a international database of the abortion pill reversal. So each case that comes up, they are studying. We're keeping statistics, and there are a couple of very good studies. Dr. George Delgado has published very good observational studies that that it works and that it's safe. So every day we're gaining more statistics with babies that are saved and continuing to follow the women over time. And it's all very positive. So yeah.
Absolutely. And one last lie I kind of hear just circulating around a lot, and this mostly has to do with pregnancy centers, but could also do have to do if it's like a pro-life OBGYN or how you yourself, you're in family medicine, you're pro-life. I keep hearing this lie that if you go to a pregnancy center, they're going to lie to you about your ultrasound or how far along you are or different things because they're going to try to convince you to not have an abortion. They're trying to convince you on their beliefs and values. I mean, you discussed that you've worked with women that have chosen life and have also had abortions, and you see the difference. You yourself, are you seeing that lie happen of doctors lying about how far along a woman is, or pregnancy centers lying about that?
Um, I actually see the opposite. That women who have been to Planned Parenthood
Mhm.
have been lied to. They'll have an ultrasound, but they often won't let them see the ultrasound pictures to see the baby's heartbeat, or to see how far along they are. I don't know. I can't really attest to what they're doing, but I know pregnancy resource clinics are licensed medical clinics. Um, the ultrasound that we're doing is a diagnostic ultrasound, just like you would get at any radiology center. We're doing the exact measurements. Mom and dad, anybody else in the room can see the measurements that we're doing that shows how far along the baby is. The ultrasound is read by a doctor. Often an outside radiology center is reading them, so there's no bias in that. Um, yeah, I feel like some of the care that we're providing at pregnancy resource clinics is much more comprehensive than what somebody could get at Planned Parenthood.
Absolutely. Well, Dr. Bowers, I always like to kind of end and wrap it up. If there is any final thing you want to share with the listeners, or anything you want them to take away, or anything we haven't touched on that you want to make sure they hear, I like to just open it up for that.
Okay. Yeah, I feel like we covered things really well. You asked great questions. Um, yeah, just be informed. Fear is a great weapon, and so being made to be afraid of pregnancy, being afraid of your life changing, those are just fears. And then furthermore, being afraid that somebody who's actually out to help you um, has ulterior motives is also just fear at its best. So support your local pregnancy resource clinics. Go in, meet them. They're great people. They provide other resources such as parenting classes for both mom and dad. often financial support, baby supplies, mostly just somebody to love and support you. It's amazing the friendships that occur between families and the Pregnancy Resource Center staff.
Amazing. Amazing. Well, Dr.
Yeah.
Bowers, thank you so much for all you do and for coming on and clearing up the difference between abortions, miscarriages, ectopic pregnancies. So thank you so much for being on.
So glad I could help.